Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hi, everyone. My name is Annie Rogers, and on behalf of the Attitude team, I am so pleased to welcome you to today's ADHD Experts presentation titled Clearing the Chaos, ADHD-Informed Strategies for Tackling Clutter and Hoarding. Leading today's presentation is Dr. Michael Tompkins. Dr. Tompkins is a licensed psychologist, board certified in behavioral and cognitive psychology. He is co-director of the San Francisco Bay Area Center for Cognitive Therapy and a faculty member of the Beck Institute for Cognitive and Behavior Therapy. He's the author of numerous articles, chapters, and books, including Digging Out: Helping Your Loved One Manage Clutter, Hoarding, and Compulsive Acquiring, and The Clinician's Guide to Severe Hoarding, a Harm Reduction Approach. Differentiating clutter from hoarding can be challenging. For people with ADHD, a cluttered living environment is as common as it is distressing. But when a disorganized home compromises health and safety, hoarding disorder is more likely at play. Today, Dr. Tompkins will explain how ADHD-related traits contribute to excessive clutter and hoarding. We'll walk through the process of managing often debilitating clutter to regain control of our homes and our health. And finally, the sponsor of today's webinar is Inflow. Sorry about the random piles of stuff is something we've all probably said to someone entering our house or car. ADHD can make it feel impossible to keep a tidy house, and the usual tips and tricks don't work for the seemingly never-ending piles of things. Inflow gets it and is here to help. Developed by leading ADHD clinicians, Inflow is a self-help program that uses CBT principles to teach effective strategies that help you stay organized, take control of your ADHD, and actually get stuff done. Click the link on screen to get your ADHD score today and kick off your Inflow journey. Attitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. Okay, without any further ado, thank you so much for joining us, Dr. Michael Tompkins. We are really looking forward to today's discussion on clutter and hoarding.
Thank you so much for the invitation and for the opportunity to speak with your audience today. What I'd like to cover today is I'm likely going to be for providing a great deal of information. I apologize that for at the beginning, but what is so important about this is to be able to help you leave our presentation today with a better understanding of the factors that can influence clutter and disorganization. So we're going to start our meeting with kind of a discussion of clutter and disorganization. And then I'm going to talk about the factors, hoarding disorder factors that contribute to clutter and disorganization. And then ADHD factors that contribute to clutter and disorganization, and then spend some time on the similarities and differences between those two conditions and the effects they have on clutter and disorganization. And then I'm going to touch on what kinds of things can help. We won't. I'm just going to review many of them, offer some examples, but there are many things that can be done to help, and I will not have time to cover those in great depth. So let's start with clutter. What's the definition of clutter? Clutter is a collection of disorganized possessions scattered about living and working environments. That's clutter. Clutter is a feature of life for most people. It's difficult to imagine, not having some clutter in one's living and working environments. And people have different tolerances to clutter, even if the clutter is not due to any kind of underlying psychological issue. Different people have different tolerances to clutter. And an increase in clutter, even if you do not have ADHD, even if you do not have hoarding disorder, can occur through normal changes in development in in life, such as, changes in living circumstances, like downsizing when you get to be a certain age will result in more clutter and disorganization for a period of time. Similarly, as we age, our functional capacity, our physical capacity, our cognitive capacity tends to decline with age. And those factors make it much more difficult, particularly the physical aspect, to maintain our living environment in the way we did when we were younger. And the last thing is zero tolerance for clutter is, in my opinion, neither easily achievable nor necessary. Actually, I think we can live very productive, effective lives with a certain level of clutter. And what I'm going to be talking to you about today is when the difference between there's clutter and then there's clutter, right? So what I'm going to be talking about today are what makes clutter into a problem for us, right? And the first is distress. If the level of clutter causes significant distress due to social isolation, due to relationship difficulties with your partner or your kids or your neighbors, or difficulties, living and working, arriving on time, remembering where important papers are, all of those contribute to distress on a day-to-day basis. If you live in a highly, highly cluttered environment, just getting through the day is enormously difficult. We take it for granted, actually, being able to get to a place on time to actually do our activities of daily living, like brushing our teeth, washing our clothes. It's easy to do those things when you have a level of clutter that is reasonable. If you have a very high level of clutter in your living and working environments, all of those tasks become very, very difficult and therefore distressing. And then the other thing that characterizes, significant clutter as a problem is disruption. That the clutter and disorganization makes it difficult to complete these activities on a day-to-day basis, right? And that also the result in consequences, whether that be ADHD or hoarding disorder. Often the disorganization leads to consequences for the individual, late payments and missed appointments and criticisms from employees or friends or family members. And the last is that clutter can be a normal response to a temporary normal response to some change in our lives. But if when you have a significant clutter and disorganization problem that starts early and stays, is both distressing and disruptive for a continued period of time, we start to think about that as a clutter disorganization problem. So what I'm going to speak to today is hope to help you walk away with a better understanding of hoarding disorder and also attention deficit, ADHD, but also how those two separate conditions can have an overlay that results in clutter and disorganization. And I want you to kind of walk away from our meeting today with a better understanding of that. And so let's start with hoarding disorder. What is hoarding disorder? Well, let's start by the distinction between hoarding behavior versus hoarding disorder. And they are actually, while hoarding behavior is included in hoarding disorder, just because you have hoarding behavior does not mean you have hoarding disorder. If you look on the left, hoarding behaviors can be the result of medical conditions like dementia, like a brain injury. Hoarding behaviors can also result from other psychological conditions. Something like obsessive compulsive disorder can have excessive collecting and saving symptoms that are not the same as hoarding disorder. And that the acute onset of many individuals will have an acute onset with no prior history of hoarding behavior. And when that happens, that's not hoarding disorder. That also suggests that perhaps there's some medical related explanation for that, like a stroke, for example, or a sudden onset or deterioration of one's mental status in terms of dementia. Hoarding disorder includes hoarding behavior, includes collecting and saving behaviors, the saving is due to difficulty discarding objects due to urges to save. There also can be excessive acquiring of objects and possessions. The result of those is the symptoms result in the accumulation of possessions that clutter the living area, and this creates distress and disruption on day-to-day functioning. It's not better accounted for by a medical or psychological condition in order to be hoarding disorder. And also, there are these diagnostic specifiers, with excessive acquisition and poor insight, meaning difficulty actually recognizing that the clutter and disorganization has risen to the level of being a problem. Most people, the vast majority of people with hoarding disorder, acquire excessively. Not everyone. And also, over time with age, for example, while the person may have urges to continue to acquire, they may have trouble doing that, either because of financial reasons, or as we age, our ability to go out and do things and go to places where we formerly acquired things becomes more limited. Right? So this is the difference. And what we're looking at today is hoarding disorder. Right? But if you have a loved one or a friend who has had a sudden onset of hoarding behavior, but no prior history of hoarding behavior, I suggest you speak to their physician about this, because this could signal some medical or neurologic event. Okay. So to help with that, let's think about onset of hoarding behaviors. We have lifelong, which is hoarding behaviors begin early, typically in hoarding disorder. This is the case where these behaviors become more significant in adolescence and early adulthood, although there is research that shows that these behaviors can occur even younger than that. And then they persist into late life. So they start early and they persist into life, right? Late onset is more no history of hoarding behavior and then triggered either by a life change that resolves, like moving from a larger to a smaller residence, or some loss, and there's a temporary loss, or even like a major depressive episode, which leads to greater clutter and disorganization, and then or a medical event. So these no prior history, often sudden onset. Then also there are individuals who the distinction between someone with hoarding disorder and the quality of the living environment. So unsanitary conditions can occur and are often found in older adults with dementia or a significant cognitive decline. Now, unsanitary conditions can occur with hoarding disorder, or they can occur without hoarding disorder, right? So just because the environment is unsanitary doesn't rule out the fact that someone may have hoarding disorder. In the case of someone with hoarding disorder, the unsanitary conditions can arise if the person has a pet or pets in their living environment that they're trying to take care of, and then the environment becomes messy because of their pets, or spoiled food, or eating in different places in the living environment, and then all of that, pizza boxes and takeout containers get kind of mixed in with the clutter itself. All right. So if you have a loved one who is living in highly, highly unsanitary conditions, this would be another reason to seek a medical consultation for your loved one, because this may not necessarily be hoarding disorder. It may be something more significant than hoarding disorder, actually. So let's take a look at the factors that contribute to clutter in hoarding disorder. And I'm going to go through these, but we're going to go through each one of these. And the takeaway from this is that, again, that clutter and disorganization is a feature of both hoarding disorder and ADHD. But often the reasons why the environment are cluttered and disorganized can be quite different. So we're going to go through these one after another. Right? So let's start with information processing factors. People with hoarding disorder have these information processing weaknesses. They have this attention bias, this tendency to actually focus on keeping rather than letting go. They tend to have categorization difficulties, meaning that it's difficult for them to categorize items because, they believe each and every item is unique. And therefore, when you believe each and every item is unique and you have 100 items, then you might need 100 file folders to organize those items. And then that's overwhelming, and the person may back away from the task. And then the person can also have, difficulties making decisions for any number of different reasons. Either they feel overwhelmed by the task itself, and the default is to procrastinate, to decide not to decide. They may have trouble deciding where to start, when to start. They may have trouble deciding what to save and how to save it. So lots of decision-making difficulties. We also can have these acquiring and disorganization factors. So people with hoarding disorder tend to buy many items, tend to buy extras, tend to save extras. They often will take free items. They will take many flyers. They'll take free newspapers. They'll accept items from loved ones or friends. So it's not uncommon for someone with hoarding disorder, if they have siblings and their mother passes away and they're trying to decide what to do with their mother's things, that someone with hoarding disorder would be more inclined to take what the other siblings do not want and are really ready to give away. The person with hoarding disorder is more likely to take those things. And there can also be stealing things, where the person with hoarding disorder can have such an intense urge to acquire something in a store, for example, they actually walk out with it. All of that acquiring contributes, obviously, to a highly cluttered living environment. Right? Then we have disorganization factors that are common in people with hoarding disorder. They tend to try to keep things in sight because they have fears about and anxieties about misplacing something, and they're reassured when they actually can see something. The problem with that is if you're trying to keep things in sight, you have to kind of spread things out over all horizontal surfaces. This leads to far more cluttered horizontal surfaces, cluttered tables, cluttered bench tops, cluttered chairs, cluttered countertops, all spread out in order to try to help the person keep things in sight. Also, what happens with people with hoarding disorder is they tend to churn, and the churning of going through possessions and going through piles and finding things mixes all of these items into, a big disorganized pile. All right. And we'll talk more about that in a few minutes. And then, of course, there are too many items to store, and therefore there is no home for these items because there are too many items. And so the place that they reside is in their living environment. And then also another thing that happens that leads to disorganization is individuals try to maintain their activities or functions. So where paying bills, for example, is a good example, or brushing one's teeth. And what happens when you live in a highly cluttered environment, like let's take paying bills, for example. You may start out with your checkbook and your stamps and your envelopes and the basket you keep bills coming in one place. As clutter fills that particular area, you take that function, that activity of paying bills, and you move it someplace else that's a bit less cluttered in order to maintain that activity of daily living, which is paying bills, right? So anything that was part of that, the stamps or the envelopes that you had, there may be some stamps and envelopes that stay in that old place, right? And then all of that is mixed in. All of that is mixed in. And this is why you'll find people with, in highly cluttered environments, they'll find checks, they'll find overdue bills, all, mixed in with the clutter. And it's all very disorganized. We also have these saving factors in which, these emotional attachment factors that are really quite strong. We all have emotional attachments to things, but when you have something like hoarding disorder, they're very strong. And so instrumental attachment is we keep something because we plan to use it for some purpose. So all of us have things in our garage. You may have a drawer in your kitchen with doorknobs and hinges and balls of string, nails, screws that you keep with the plan one day to use them. We also have sentimental attachments you likely have in your home, uh, albums of photos of your wedding or things your kids when they were little made and that you kept. And these sentimental attachments, we keep those items because they are our connection generally to memories, pleasant memories of the past. And so we have sentimental attachments as well. And then intrinsic attachments are attachments we have to objects, some quality of the object, which can include, the artwork, the paintings that you have, things that you may have found, on a walk on the beach, that in a piece of driftwood that you find in your eye, very interesting, and so you keep it. And again, we all have these attachments to things, but when you have something like hoarding disorder, those attachments are very, very strong. And so letting go of something is much, much more difficult, right? We also have these, people with hoarding disorder also have these erroneous beliefs about perfection, that there's a perfect way to store something, there's a perfect way to keep something, there's a perfect way to acquire something, right? They can also have thought beliefs about lost opportunity. So they'll keep something because they think there may be some unique opportunity here that if I give this away, then I lose that opportunity. So, a business card that someone gives them or something like that. There are these beliefs about responsibility that once, an object comes into one's home, the person believes that now they're responsible for the appropriate use or discarding of that item, and which leads them to having trouble like letting go and giving people the responsibility to let go, discard or use a possession. Right. Also, beliefs about safety. People with this problem hoarding disorder can have beliefs about safety. They feel safer or believe that they're safer in a highly cluttered environment than a less cluttered environment. And then also people with hoarding disorder will have doubts about their memory, even though their memories are within normal limits. And we have a number of research studies that show this, that people with hoarding disorder doubt their memories, even though their memories are fine. When you doubt your memory, then you're going to be more likely to keep things or keep multiple things and things like that. So those are belief factors. And then we have all these reinforcement factors that reinforce largely the clutter. And so we have negative reinforcement, which is, for example, when we think about letting go of something and we feel anxious about it, when we keep it, we actually reinforce keeping because we feel less anxious now because we've kept it. And that is called negative reinforcement. We reinforce that behavior by removing a negative consequence. Right? Then we can have positive reinforcement factors, which is a behavior that's reinforced because it results in some positive outcome or consequence. So people with hoarding disorder, and probably all of us have experienced this from time to time, when you go shopping and then you find the perfect, a really great bargain, all right? And you revel in how much money you saved. The emotional experience you have is positive, right? And so that then reinforces for the behavior of looking for bargains, for example. And so that can happen in hoarding disorder as well. And then we have a lot of avoidance that is reinforcing for the behaviors, like, people will avoid and therefore will either start to declutter and then stop, or they'll put off decluttering. They'll avoid discarding because discarding is uncomfortable. They'll even avoid organizing because organizing is overwhelming. They'll avoid making decisions. They'll avoid starting to clear because it's overwhelming. They'll um, so, and then churning items also results in both negative and positive reinforcement. Like if we churn a pile and we discover something, we might feel relief. Oh my gosh, I thought I had lost that. And we feel relief. Or we may discover something as we turn through a pile that creates, like a memento, like, oh, and then that triggers, fond memories of something. And both of those reinforce for keeping items. So we have any number of reinforcement factors that result in clutter and disorganization. And there are many factors in hoarding disorder that result in clutter and disorganization. In ADHD, we have these three pieces of ADHD: the hyperactivity, inattention, impulsivity. As you likely know, most adults with ADHD, we move from many times having ADHD, but as we develop and become older adults, we may be more inattentive. And so these are the three spheres. But what we look at in factors that contribute to clutter is we look at different things going on for individuals with ADHD. They too have a biologic substrate. They also will have difficulty planning and organizing. They often will have difficulty estimating time and managing tasks. So difficulties with time awareness, difficulties with managing tasks, breaking down tasks, planning tasks, following through with tasks, difficulty solving problems for sure, that leads them to feel very overwhelmed, and difficulty that result in all of those things result in difficulty initiating and sustaining tasks. So if the task is managing, the clutter and disorganization in your living environment, it becomes much more difficult to initiate those tasks and to sustain those tasks to make, sufficient benefit, for you. So different factors, but both these factors still result in clutter and disorganization. So poor task initiation persistence also can be influenced by executive function deficits. Executive function, I'll talk more about that, is these higher order cognitive processes that influence us initiating a task and sustaining tasks. But anxiety can too. Like if we're very anxious about a particular task or activity, we actually may have trouble starting that activity. If you're worried about the outcome or you're feeling anxious and overwhelmed, you might actually have trouble initiating that task and sustaining that task over time. And then depression, depression can result in loss of motivation, and loss of motivation can result in difficulty initiating tasks and sustaining them as well. So there can be a number of factors. And so interestingly, many individuals with ADHD can have all three of those things, and many people with hoarding disorder can have all three of those things. Right? And so, my theory of human beings as a psychologist is people are complicated, and there can be many factors that contribute to a particular problem or problems an individual is having. And this is why it's so important. There are no simple explanations necessarily, because people are complicated. And we'll say more about that as we move through today. Now, these are executive function factors. There are many of them. Time management, managing time, managing, planning, organizing activities and tasks. Also, working memory. Working memory is this process, this cognitive process of being able to hold two things in our memory long enough to do a particular operation. Now, working memory can be holding, the numbers 27 and 14 together long enough to add them together to get the final result. Then once we get the final result, working memory's done its job and we let go and it moves on, right? Working memory can also result in other influence other tasks. So like when I come in the house and with my car keys, for example, I hold two things in my mind at the same time. The wish to put my car keys in the usual place. And while as I walk through the house, it's necessary for me to hold in my working memory my intention of putting my keys in the same place. That's working memory. And when you have ADHD, those kinds of tasks are very difficult because one's working memory tends to be weak, right? And so all of these result in problems in terms of clutter and disorganization. So let's take a few of these, right? Organizing and planning. Weaknesses in organizing and planning that are central to ADHD make it difficult to identify the logical and explicit steps required to declutter and organize your living and working environments. Right? Decluttering and organizing requires planning and organizing, right? And when you have ADHD, those tasks are very difficult, right? Also, weaknesses in organizing and planning skills tend to result in people feeling very easily overwhelmed because they have trouble thinking ahead and planning, developing a plan to actually break things down and execute them and calendar them and all of those kinds of things. And so once overwhelmed, the person tends to procrastinate or back away from the task. All of this results in things being left as they were. Working memory, we talked about that. It's very difficult to stay on task when you're decluttering and organizing your living environment, when you have working memory difficulties. And the main problem is that being able to manage the level of clutter and organize our living environments involves multiple steps. That we start with step 1 and we proceed to step 12. Right? Doing one after the other, right? When you have working memory difficulties and difficulties with planning and organizing, all of that is very, very difficult. Right? And the last in ADHD, in terms of time management, many individuals with ADHD have poor time awareness. They tend to underestimate the amount of time a task takes, And when you underestimate the amount of time a task takes, you tend to run out of time, because if you calendar those tasks, if you underestimate the amount of time a task particular takes, you're always kind of running behind. You're always kind of running late, right? And you'll see that many individuals with ADHD, have an appointment. They want to get out of the door at a particular time. They think, oh, this will take me 15 minutes to do. I have 15 minutes before I have to leave. They underestimate how much that time it takes. It takes 30 minutes, and now they're 15 minutes late to their appointment. Right? Also, individuals with ADHD basically had, a weak time management skills in general, the ability to break down tasks and do a number of things like that. Now, what does this mean when we think about the bigger picture? Right? If you look at hoarding disorder, something like almost 30%, almost 1 in 3 individuals with hoarding disorder have a co-occurring diagnosis of ADHD. Now, what I'm going to say to you is there is a much, much larger universe of people with hoarding disorder who their ADHD symptoms, those symptoms that we've gone over, don't rise to the level of being a diagnosis, but the weaknesses are still there. Right? Like executive functioning and difficulties in planning and organizing. They might not, those weaknesses not rise to the level of being a diagnosis of ADHD, but they're there nonetheless. Right? And so even if you have hoarding disorder, even if you do not have a diagnosis of ADHD, you can still be susceptible to some of the weaknesses and difficulties that people that are part of ADHD. Right? So, bottom line, clutter and disorganization. Clutter can result from psychological processes that we've covered in hoarding disorder. They can also result from neurocognitive processes like that we've covered, both of those can result in difficulties managing the level of clutter and in one's living environment and managing and trying to keep those items organized. And the really important takeaway from this also is disorganization is both a consequence of clutter and a result of attempts to manage clutter, right? And so it's not just the amount of things coming into one's living environment that results in disorganization. One's attempts to manage the level of clutter and therefore manage one's life results in disorganized, disorganization with one's living environment, right? So what are the differences and similarities? Well, if you look at this table, in hoarding disorder, we have these intense urges to acquire. This is not necessarily the case with people with ADHD, right? Also, the people with ADHD, if they do acquire, it's much more impulsive, meaning they have more trouble with inhibiting an impulse to acquire, and they don't even think about it. In fact, if they could hit the pause button, someone could help them hit the pause button, they likely would say, no, I really don't need that, right? Someone with hoarding disorder, someone saying you don't really need that doesn't really work. The person says, no, I believe I do need that, because not walking away from it leaves me with this distress, and acquiring it resolves that distress, that calms that distress, right? Also, both people with hoarding disorder and ADHD can have difficulty decluttering due to an organizing task, for sure. They can both, in hoarding disorder, you have more significant difficulties making decisions, right? But both can have difficulties in solving problems. In something like ADHD, the difficulty solving problems can often be just not enough practice, but solving problems also requires planning, and managing tasks. And so both of those things can be common in both of them. People with hoarding disorder can have trouble categorizing items, breaking tasks down into categories, or but people with ADHD only typically do not. They can actually categorize items okay, but they get distracted easily from the task. And then both can have some difficulty planning and prioritizing. Both can have some difficulty like being flexible between tasks for different reasons. Both can have difficulty managing distractions for somewhat different reasons. And then, people with ADHD typically will have more trouble managing time with someone rather than someone with just hoarding disorder. And then, managing emotional responses. Both individuals, whether you just have ADHD or just have hoarding disorder, you can have some difficulty with emotion regulation, controlling your emotional state. But often the reasons are somewhat different, right? But people can have that. So some other considerations, and then is that, there's a range of executive function weaknesses. I said that even if you don't have hoarding disorder and you just have that even if you have hoarding disorder, you can still have some executive function weaknesses, even if you don't have ADHD. And these age-related cognitive and physical capacity changes can actually affect one's ability to kind of maintain their living environment, right? So what can help? Well, I'm not going to go over the details, but I'm just going to kind of give you a general view. Both cognitive behavior therapy is effective for both hoarding disorder and ADHD, right? And there's some overlap in what skills one learns in CBT for hoarding disorder and what skills someone learns in CBT for ADHD. So skills that both you would learn, that both have them, are modifying the environment to manage distraction, developing systems to track and delay delay distraction techniques, prompting and cueing techniques, using a timer. That's a really, if you haven't tried this, to help with staying on task, use a timer. I usually recommend a Cook's timer that's on a lanyard. You basically start your decluttering. You set the timer for 10 minutes. When the timer goes off, you're to ask yourself the question, am I still doing what I did when I set the timer? If the answer is yes, you set the timer for 10 minutes again. What this does is it helps you not lose so much time, because when you have something like ADHD, you tend to start a task and then you can get distracted by something else and start another task and start another task. And what ends up happening is you diminish your effectiveness in a decluttering task, for example. Okay, both hoarding disorder and ADHD can have difficulties in using calendars and organizing paper, developing systems. Organizing paper can be for different reasons. For example, like if you have hoarding disorder, for example, organizing paper may be difficult because you are looking for the perfect way to organize paper, or you're excessively worried that if you put this piece of paper in this particular file, you may forget that it's in this particular file. Right? Someone with ADHD may have just difficulty thinking about organizing and following through with organizing. Right? Skills, in managing tasks, both can help both. Prioritize in CBT for hoarding disorder. There's skills about teaching you to prioritize tasks, graded tasks, meaning breaking tasks down to help with the overwhelm feeling. Pomodoro technique you may be familiar with, which is combines breaking down and tasks by time. The Pomodoro technique is basically you start a task, you work for 35 minutes, you take a 5-minute break, you go back to the task, you work for 35 minutes, you take another 5-minute break. You do that 4 times. At the end of the 4th time, you give yourself a longer break, like 30 minutes or something like that. So there are tasks to actually help manage task initiation and persistence. And also there are tasks in both that, that can improve time awareness. So even like being able to actually estimate the amount of time a task takes, write it down in one column, and then write down how much time the task actually takes. It builds an awareness of time with doing that over time. And then strategic time management is basically being able to plan and organize time moving forward, small tasks that can be done in those moments when you're waiting for the doctor or you're waiting in the car to pick up your kids, things like that. Right? Again, all managing time and managing tasks, all are really addressing the weaknesses in being able to plan and organize one's tasks and time. Medication supports can be, typically for medication supports, the research is not great in terms of being able to help hoarding behavior, decrease hoarding behaviors, but they can be very helpful in treating other co-occurring conditions that can make basically building, these skills and building these skill habits. So anxiety, depression, as well as ADHD. So while you may, if you have something like ADHD and you have hoarding disorder, and you certainly can have both, 1 in 3 chance, a stimulant medication can help you with the ADHD, and helping with the ADHD can better help you initiate a task and sustain a task, right? Help acceptance, a very common problem. People with only ADHD will tend to be more open to accepting help than people with hoarding disorder. In fact, you'll notice if you just have ADHD, you can make a lot of progress if you have someone just being there with you to help prompt you to stay on task, to offer a word of support while you declutter and organize possessions, right? Whereas with hoarding disorder, whether if it's just hoarding disorder, the person is not necessarily going to be able to be effective in decluttering and organizing their possessions because there are so many other reasons that we've covered that do not include, just feeling overwhelmed by the task and just prompting to stay on task. So but the bottom line also on this is help acceptance is most definitely influenced by the quality of the personal relationship the person with hoarding disorder has with loved ones. And if that relationship is distressed, which is often the case, that results in more help refusal. While this is less common with people with just ADHD, it can be there with people with ADHD because many people with ADHD have histories of rejection and criticism that make them quite sensitive and worried about rejection and criticism from others for forgetting something or doing something wrong or thinking they read the directions but misread them, right? So we're going to move to questions now, but big takeaways here. Both hoarding disorder and ADHD include significant executive function weaknesses. So there's like 1 in 4, 1 in 3 chance that if you have hoarding disorder, you actually have a co-occurring diagnosis of ADHD. But even if you do not have a co-occurring diagnosis of ADHD and you have hoarding disorder, you're likely to have some level of weaknesses in those executive function processes. Although hoarding disorder and ADHD both result in cluttered and disorganized living and working environments, the reasons for that can look quite different. And this is why different treatments are often needed. Cognitive behavior therapy is an effective treatment for both ADHD and hoarding disorder, and there is some overlap that includes many of the same skills, but not all skills. So with regard to ADHD, someone with just ADHD might not do letting go exposures because letting go is not difficult for them, right? Whereas someone with hoarding disorder, letting go is quite difficult for them, right? All right, so bottom line, knowing who you are, what's going on with regard to your particular clutter and disorganization is essential in order to be helped. Okay, so I think that's it. We have some time for some questions.
Yes, thank you so much, Dr. Tompkins. I will start by quickly thanking Inflow once more for sponsoring today's webinar. And then I'd like to turn to the results from the survey question that we asked at the outset. We asked what prevents you from dealing with the clutter that's disrupting your life and impacting your happiness. The number one answer was overwhelm and paralysis, which I can say I'm not surprised by. And you talked about how CBT can teach some techniques like breaking down tasks and using the Pomodoro method to begin chipping away. But I wonder about the emotional side of the overwhelm, the shame, the feeling of sort of personal fault, even the rejection sensitivity, and how maybe you could recommend some CBT techniques to help people overcome those first emotional hurdles.
Yeah, what you're looking at is a particular behavior, which is task abandonment or procrastination, task avoidance or abandonment. But there can be a number of factors that cause that, right? And sometimes it's just feeling overwhelmed because, the task just seems very daunting and the person lacks the ability to slow things down and break things down and develop a plan to do it, right? But other thing, anxiety may be a piece of it where the person with hoarding disorder, for example, thinks about decluttering something. And in order to declutter, one needs to put things into categories, if nothing like keep, let go, give away. And if the person is anxious about making the wrong decision, like, is this I'm particularly giving away something or letting go of something, they can feel really anxious and then they back away from it. Right? Shame is another emotional state, that can come up for people when they actually become highly self-critical. And, there are strategies within cognitive therapy, compassion-based skills, teaching one to be self-compassionate in those moments can be very, very helpful. And how to do that, how to move from this mode of self-loathing into this mood of self-compassion. Because when you are a state of shame tends to also cause us to kind of abandon the task. And in fact, to just have wishes to leave the scene, right? And so there are any number of skills depending upon what the emotion is. And again, there isn't one thing, this is like, goes back to my point, is like people are complicated, knowing what skill or skills would be helpful depends upon you knowing who you are and what's going on for you, and your therapist knowing who you are and what's going on for you in order to actually direct you into appropriate skills to help you.
Okay, very helpful. And you touched on another big point that is coming up today. And I wonder if you can just outright answer, is there any right or wrong way to determine what sentimental items specifically to keep? A lot of people really struggling with this idea of making a terrible mistake and carrying some regret with them. And that seems to be a hurdle
Yes.
in so many different areas.
The difference, yes, the what happens for people with hoarding disorder about making a mistake, about letting go of something that they're a sentimental possession, is feelings of regret. Feelings of regret. We've all experienced this, where we let go of something and then later on we realize, oh, I wish I had kept that. That is kind of a universal human experience, right? The difference between someone with hoarding disorder versus someone without hoarding disorder is the person without hoarding disorder views that state of regret, that emotion of regret, as something that will pass with time and that they can tolerate. Right? When you have hoarding disorder, you don't believe you can tolerate that level of, you don't believe you can tolerate regret, right? But you can, right? We all do. But it's a belief about your ability to tolerate and cope with regret. And two, the thing that will help you be more confident that you can cope with it is to remind yourself that emotions change over time. And even if you have hoarding disorder, if you've ever had a regret where you mistakenly, I guess, let go of something and you experience regret, I am willing to bet that you don't feel the same intensity of regret today about that event than you did in the moment. And that's because emotions change with time.
Wonderful. I will move to the second biggest hurdle that people cited in our survey, getting in the way of their clutter clearing, and that was problems with focus and continued motivation. And I wonder if you can offer any advice for those people listening who said, okay, I can get the bedroom clean, and within a week, it's in a terrible state again, and it's really impacting my emotional state, my self-esteem. How can I motivate myself to keep systems in place when it's so boring?
Well, I mean, boring, when you have ADHD, boredom is just a catastrophic state. Meaning, when you have ADHD, boredom, the state of boredom is very difficult to tolerate because ADHD, the way I think about ADHD, it's a mental effort problem, meaning that it takes mental effort. We have a mental effort hill. Okay? And when you have ADHD, that hill is very high. And so it takes a lot more mental effort to initiate and sustain a task than someone without ADHD. Right? And the tasks that are require the most mental effort are tasks that are boring. Right? And we have research that shows that people actually with ADHD report a higher incidence of boredom than people without ADHD, because more tasks they experience as boring because they're more sensitive to the boredom state, because their mental effort hill is so high. Right? So what you want to do, again, there can be lots of reasons that you have low motivation, but if the reason is you're feeling overwhelmed, skills that will help with that is breaking the task down, setting realistic time to work on the task. Typically 30 minutes is more than anyone can actually work on the task, because breaking it down, identifying particular areas and that are small areas. I usually suggest people kind of like have like a hula hoop, and you just work on the area within the hula hoop and only within the hula hoop, so that you can actually see that you've accomplished something. When you have hoarding disorder or ADHD, you work on something for a little while, but you get distracted, and then you're working on this, and then you get distracted, you're working on that. And so you could work several hours, but when you look at what you've accomplished, you cannot see it. But if you focus on what's in the hula hoop, you can actually see that you have actually produced some change there, right? The other thing is managing distractibility. Using the timer is a strategy of that. Masking off items. So if you have your hula hoop, and you're working on these areas, cover the other areas with a drop cloth, so that you are not distracted by things, or identify a particular pile of items to work on, put them in a box, and then move that to a different area and face the wall so that you're less distracted by items. There are lots of skills that you can learn to manage distractibility as well.
Okay. And you mentioned the use of a timer in the Pomodoro technique and other ways. And some people are saying, they'll play little games with themselves, gamifying the boring task of decluttering, saying,
that's
can I get this section done in the 30 minutes, and
that's
challenging
beautiful.
themselves.
Beautiful. And sometimes just changing up the task, listening to music, if you do not find it distracting, can lift, take something else, make it a little less boring. You can, chew gum. There are lots of skills that you probably have learned from ADHD specialists to lessen boredom. All right. And you just, if they work, that help you initiate and stay on task, that's great. If you use something that makes it more difficult to initiate and sustain a task, that is not helpful. All right. So you really have to figure out what works for you if your goal is to start and sustain tasks.
And I do need to ask, because a lot of people are asking if you have a recommendation for how to find a cognitive behavioral therapist who understands both ADHD and hoarding tendencies or hoarding disorder. Is there a good place that people can go?
Probably the place to start is with hoarding disorder, because people who are specialists in treating hoarding disorder will understand ADHD. Someone who's a specialist in ADHD may not necessarily understand hoarding disorder. Right. So the place to go that with hoarding disorder is to go to the International OCD Foundation. There is a place on that website for hoarding, and you can find resources to people who are specialists in the treating of hoarding disorder. I will say to you that the numbers of those people is small, right? But that's the place to find them. So www.iocdf.org.
Perfect. And we will include that also, everyone, in the resources here that we send out to all webinar registrants. So don't worry if you missed that. And Dr. Tompkins, I'm sorry to report that we are out of time. Thank you so much for joining us today and contributing this really thorough and interesting comparison, inspection of ADHD and hoarding tendencies, and also these strategies to help our listeners.
My pleasure. It's been a pleasure hanging out with all of you today. Take good care. Bye-bye.
Thank you. And thanks to everyone who joined us today listening. If you would like more from the event resources, you can visit attitudemag.com and search podcast 510. The slides and recording will be posted in a few hours. And if you're listening in replay mode, you can just click on the episode description to get all of that. And please know that our full library of Attitude webinars is available as a podcast. It is called the ADHD Experts Podcast, and it's available on all streaming platforms. To make sure you don't miss any future webinars, articles, or research updates, just sign up to receive our free email newsletters at attitudemag.com/newsletters. Until we see you next time, thank you for joining us and have a great day.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.